Hello student. Today we are going to study the drugs acting on central nervous system. Before dealing with the study of the drugs acting on the central nervous system, we first discuss about what is meant by nervous system, various parts of the nervous system. Nervous system, which is mainly divided into two types, peripheral nervous system and central nervous system. Peripheral nervous system again get divided into two types, efferent and efferent, which carries the sensory impulses which are called as afferent nervous system, and which carries the motor impulses towards the body, it is called as efferent nervous system. This efferent nervous system again get divided into two, somatic nervous system and autonomic nervous system. Somatic nervous system is dealing with the skeletal muscles, or which is a voluntary action movement, and autonomic nervous system which is deals with the non-voluntary movements, which is get divided into two types, parasympathetic division and sympathetic division. Second one part of the nervous system, which is a central nervous system, it is again get divided into two, brain and spinal cord. Here we are going to study this drugs acting on the central nervous system. Drugs acting on the central nervous system firstly goes through the blood circulation to the CNS is very large, but only the minute amount of exogenous substance can penetrate the blood-brain barrier. This concept is used to describe the phenomenon by which the penetration of substance into the central nervous system is either facilitated or hindered. In general, lipid-soluble non-ionizing molecule can pass most readily into central nervous system. The drugs which reach the central nervous system and produces the depressant effect are called as central nervous system depressant. The central nervous system depressant drugs are categorized as: first, general anesthetic, example is diethyl ether; second, hypnotic and sedative, example is phenobarbital; third, anticonvulsant, example is phenytoin; third, tranquilizer, example is chlorpromazine; and fifth, central nervous system depressant with the skeletal muscle relaxant property, example is meprobamate. Today we are going to study general anesthetic. What is mean by general anesthetic? General anesthetics are the drugs or substances which are acting on the central nervous system, and these are mainly central nervous system depressant drug that produce a partial or total loss of sense of pain accompanied by the loss of consciousness. There are some stages which are observed after administration of these general anesthetic to the body. These stages are get divided into four. First stage, it is called as analgesia, which is due to the depression of cortical center. These cortical centers which are present on brain. This cortical center firstly get depressed. Second stage, it is also called as stage of excitement or stage of delirium. It is due to the depression of higher motor center. See, in first stage analgesia, this minor surgery or minor tooth extraction like procedures are carried out in first stage, because duration of action of this first stage analgesia, it is very short. If we induce a drug more dose, then the second stage and third stage it is observed. In the second stage of excitement or stage of delirium, we observe the various symptoms like laughing, sneezing, coughing, and sometimes patient shows the motor activities by hand limbs and forelimbs. So the stage is called as stage of excitement. Third stage is surgical anesthesia, which include the loss of spinal reflex. In the third stage, mainly it is surgical operations are carried out in this third stage. First is loss of the spinal reflexes with the skeletal muscle relaxation, and it is very useful for the surgery. Somatic muscle relaxation and disappearance of muscle tone. Somatic muscles which are present in organs and system which are get relaxed, and disappearance of muscle tone. This stage is essential to carry on surgical operation. And fourth stage is medullary paralysis, which is due to the overdose. In this, there is a respiratory failure or and vasomotor collapse is observed. Next is the classification of the general anesthetic. Depending upon the route of administration, general anesthetics are classified into two major groups. First one is the volatile and gaseous anesthetics administered by inhalation, In that first category is gases. Inorganic gases, example is nitrous oxide. Hydrocarbons, example is cyclopropane, ethylene. Volatile liquids, in that halogenated hydrocarbon, example is halothane, trichloroethylene. Ether, example is diethyl ether. Second category is fixed anesthetic administered intravenously. These are first ultra short acting barbiturates and thiobarbiturates. Example is methohexital sodium, thiopental sodium, and miscellaneous compound ketamine and alphaxolone. We will see in detail the structure, physical properties, chemical properties, brand name and dosage form of general anesthetic in next lecture. Thank you.